Here is a list of symptoms that may appear during alcohol withdrawal. Alcohol craving, tremor, irritability, nausea, sleep disturbance, tachycardia, hypertension, sweating, perceptual distortion, seizures that occurs between 6 to 48 hours after your last drink, visual and occasional auditory or tactile hallucination that occurs between 12 to 48 hours after your last drink. Delirium tremens occurs between 48 to 96 hours after last drink, is rare in uncomplicated withdrawal. Severe agitation, confusion, fever, profuse sweating, tachycardia, dilated pupils, and diarrhea. Others who suddenly abstain from alcohol may also show signs of a psychological dependence, compulsively wanting to feel the effects of alcohol.
So, how can we help people who are alcoholics? For pharmacologic treatment and alcohol withdrawal drug therapy, the major objective is to prevent seizures, delirium, and arrhythmia. In alcoholic patients with liver disease, lorazepam and oxazepam are preferred, which are short-acting drugs. In preventing the alcohol withdrawal symptoms, short-acting benzodiazepines such as oxazepam is preferred. 15 to 30 milligrams can be taken every 6 to 8 hours depending on the severity of the symptoms. However, some recommended long-acting benzodiazepines given that there is no liver impairment. Anticonvulsants are also used, but they are not as effective as benzodiazepines. Disulfiram has been useful for the treatment of chronic alcoholism by producing acute sensitivity to alcohol. This results in the blockage of enzyme aldehyde dehydrogenase, which helps in detoxification. Once alcohol is ingested, some effects of hangover will be felt. However, during clinical trials, many patients opted not to drink disulfiram than not to drink alcohol. Naltrexone is an opioid receptor antagonist that blocks the effect of feeling good when taking alcohol or the likes of it. Long-term administration of naltrexone helps control or even stop the addiction behavior. Overall, the effects of naltrexone are consistent in the reduction of alcohol addiction. Naltrexone works best when combined with behavioral and psychological treatment to comply with medication and abstain from drinking alcohol. Acamprosate is a competitive inhibitor of the NMDA-type glutamate receptor that appears to normalize the dysregulated neurotransmission associated